So today we're going to be working a lot more on getting into the pelvic floor, working on bringing breath down into the pelvic floor, trying to get some length into the pelvic floor, as well as some activation of the pelvic floor. Related to a few different movements, we're going to work on it through breath, through shin box, and hopefully if we have enough time, we're going to get into a little bit of deep squat breath as well. So, should be a good one. Let's get started. So we're going to start on our back with our feet on the chair. I want the knees to be a little tighter than 90 degrees, or sorry, the hips a little tighter than 90 degrees. So I want the knees to be above the level of the hips in order to help keep that low back nice and flat to the floor. We're going to start with some crocodile breath. So we're going to make some big C shapes with our hands. Thumbs are going into the low back musculature. I want to kind of be able to press and feel the muscles of the low back. I don't need to feel them real detailed. I just need to kind of feel their texture so that when we breathe, we can feel them expand. Index fingers are going into the front, into the abdominals. Same thing. I just want to kind of feel that musculature. And then the side palms are pressing into the side of the body. So we got 3 points of contact on each side, and I want to be really sensitive with sense and feel through the tips of the index fingers, thumbs, and the side of the palms. We're going to inhale and expand that abdominal wall to try to get it to push out and away into each of those points of contact. And on our exhale, we're drawing our navel all the way into our spine. As we exhale, I want to let your fingers or your hand clasp a little tighter in order to create some resistance for your inhale breath to expand out and away into. That exhale, we're allowing that belly to draw all the way into the spine, trying to get as much breath out as we comfortably can, and then immediately filling up that wall, and we're blowing up the walls of our abdominals like we're inflating a balloon. We have our hands palpating so that we can kind of assess the quality of how well that balloon expands, and especially how it expands evenly. You may notice that that balloon wants to expand into the belly fast, and it may not expand into the side or into the low back as well. We're going to try to set our intention to see if we can get an even expansion in all directions, like we're inflating a balloon on that inhale. And on the exhale, draw the navel into the spine. It's almost like you're trying to push your spine into the floor with your belly button. After you get about 5, maybe up to 10 breaths, we're going to let the knees move out and away. I want the knees to be wide at shoulder, kind of shoulder width, maybe a little bit wider. But have your feet still touching together. I want the heels touching as well as the ball of the foot touching. Outside edge of the foot are going to be apart, kind of in a little bit of a frog position. Hands are going to press into the knees, and we're going to push to extend the elbows out as much as we can. And at the same time, we're going to pull our knees into our hands. This is going to create some pressure in the abdominal walls. I want to make sure our head and our shoulders are soft and relaxed on the floor. If you're finding that your shoulders are rounded up and your head needs to be lifted, then go ahead and place a pillow or a folded up blanket or something underneath your head and your shoulders so that you can allow your shoulders and your head to relax as much as possible. So we got this nice tension. We're actively pushing away. We are actively pulling in, and we're coming right back into that crocodile breath or that balloon breath. Inhale, filling up the abdominal wall in all directions. Again, it's normal for that belly to rise easier, so I want to really focus on feeling the back expanding into the floor. I want to kind of feel that expansion of a balloon. If you got a balloon that you're lightly pushing down and you add inflation into it, you're going to see that balloon bow out, pressing down into the floor and then moving out to the side. I kind of want to have that same effect with our abdominal wall. With each inhale, we're working to expand. On the exhale, drawing navel into the spine. And I want to start to feel that breath on the inhale moving down our spine into our pelvic bowl. And I want to see if we can feel some expansion of that pelvic floor moving down in a way on the inhale. On the exhale, as we draw the navel into the spine, we can start to do a light Kegel. We can start to squeeze like you're trying to pinch off going to the bathroom. Either do a number 1 or number 2. On that exhale, light squeeze. On the inhale, I want to breathe into that squeeze and feel that squeeze expand and stretch. It may not feel like a stretch, but I want to feel that lengthening, that expanding out and away. Exhale, navel to spine. Activate that Kegel lightly. Inhale, allow that breath to expand that Kegel. After 5 to 6 breaths, we're going to soften our arms and we're going to slowly shift positions and we're going to come up into a shin box position. We can move our chair out of the way. So from shin box, I'm starting in my right side shin box, bringing right hand down. So right side shin box, my right knee is forward. This is the side that my chest is opening up to. Right palm is coming down. We're going to spiral that palm out and away and see if you can feel that shoulder blade dropping down your back and your chest lifting up to the ceiling. And we're going to come back and do the exact same breath that we just did. Inhale, feel that expansion of the belly and the abdominal walls. I want to feel that balloon breath in all directions. On the exhale, we're drawing navel into our spine. And I want to really feel, because of the basic position that we're in, we should get a little bit more breath moving into the side of the shin box that we're on. Since I'm on right side shin box, I want to see if I can get that breath to expand a little bit more into the right side of my abdominal wall. It's not going to move quite as much into the left. We can even bring our hand over here just to lightly palpate and touch to bring awareness to where we're trying to bring that breath in. On the inhale, feel that breath expanding out and away. On the exhale, drawing navel all the way into the spine. See if you can feel some light stretch in that abdominal wall, especially through the side body or even into the low back. We're trying to get into some of that space where it's hard to get that breath to expand. This is a good assessment point to notice. Does it feel tight? Is it restricted? Does it feel difficult to get that breath to move? And after 5 good breaths, we're going to shift across to the other side and do the same thing. Grounding the palm, spiraling the elbow out and away. Feel that shoulder blade dropping down the back, lifting up through the sternum, and then bringing that breath down into that side body. Now I'm on my left side, so it's going to be left side abdominals. Opposite hand can lightly palpate that side. I don't want to be palpating directly in the front. I want to be as much to the side or even into that low back. And I'm just lightly touching so I can bring the focus of that inhale into that hand and feel that breath expand out and away. Exhale, drawing navel all the way up and in. And again, right back into that inhale breath, expanding that balloon out and away. Notice, how does it feel on this side that is easier or more challenging than it was on the other side? And after 5 breaths, we'll shin box across back to the other side. And we're going to do the exact same breath, but we're now going to start adding some other layers of movement into it. So I still want inhale, expand out, feeling that expansion. Exhale, drawing navel into the spine. And now we're going to add our movement of the back hip. So as we inhale and expand, allow that back hip to drop down like you're trying to touch the floor with the back hip. As you exhale, drawing the navel in, you're scooping your tailbone forward, seeing how far can you reach your tailbone, letting that hip come off the floor, rolling over the top of the other hip, and it's like you're trying to touch something out in front of you with the front of your hip bone. And we're actively trying to scoop into it while we're exhaling, drawing navel in. Inhale, allow that hip to drop all the way back as you inflate into that side body. This is going to, all of these movements are going to become more and more progressively challenging, especially if you're not familiar with it. If this is new neurology, working on breath, it's going to be normal for this to be difficult to sink, and it may feel frustrating at times. So that is a normal part of the process. If you're feeling frustrated, take a deep breath and just try to resync. The more you try to resync up, your body will eventually get it. Again, nice inhale, expanding out and away. Exhale, drawing navel into spine, hip bone shifts forward. Feel into that front of the hip. Can you feel some stretch on that exhale, especially as you draw that belly up and in? Inhale, allow that hip bone to drop all the way back as you expand out into that side body belly. After about 5 breaths, we're going to shift across to the other side and do the same exact thing. Grounded palm, spiraled elbow, packed shoulder, open chest. Inhale, filling up that side bowl of the belly, allowing that back hip to drop to the floor. Exhale, drawing navel into spine as you lift that back hip and scoop that pelvis forward, feeling into that front of the hip. Inhale, feel the side body. Exhale, nice drawing in. Can you feel that nice stretch on the front of the hip on that exhale? On the inhale, can you feel that hip drop down? And can you feel that side body expansion of the balloon? And how does it feel that's different on this side compared to the other side? Again, if this is new, you may not be able to do a lot of comparison from one side to the other because you're simply trying to learn the neurology of the breath and the movement. So focus most on where you're at the moment. If that's just getting comfortable with the breath, that is fine. Coming back to the other side, again, grounded palm, spiraled elbow, packed shoulder. We're going to do the exact same thing we just finished on. Inhale into that side body, allowing the back hip to drop. Exhale, drawing navel into spine and scooping the tailbone forward. And now we're going to add our reach with rotation, imagining that I got a piece of bread and I got somebody who's sitting directly where my knee is pointed. I'm going to reach through my knee like I'm trying to hand off my bread to that person. Inhale, I'm bringing it all the way back, allowing that back hip to drop. Inhaling into that side body. Exhale, drawing navel in, scooping the pelvis, and then adding in our reach. There's a lot, again, each layer that we start adding into this, if this is new for your neurology, it's going to be hard to sync all these little things together. So it's normal to get out of sync with it. Just do the best you can. The more you practice it, the better you will get. Just like learning to play the piano. You got to work on each individual note before you ever get to play any kind of music. This is the process that we're in. After 5 on that side, we're going to switch back across and do the same thing on the other side. Grounded palm, spiraled elbow, packed shoulder. Inhale, filling up that side body, allowing the hip to drop down. Exhale, navel to spine as we scoop, and now reaching directly through the angle of that arrow of that knee, sharing our breath. Inhale, bringing it all the way back. Allow that hip to drop down to the floor. Fill in that side body. Exhale, scoop, navel to spine, and then add in that reach. The slower the breath is, the better. It'll be the slower we go, the easier it will be to coordinate all the breath, all the movement. The faster we get, the easier it's going to be to get out of sync. Now we're going to bring it back across again, and we're going to kind of change our position a bit. So I'm in right side shin box, but now I'm bringing my right hand off the floor, and I want to bring my arm up and over, allowing my elbow to bend. I want my forearm kind of flush with the ceiling. And we're doing the same breath into that side body, that right side body. Same, if my hand was down, hand is up. I'm still breathing into the same space. On the inhale, we're still allowing that back hip to drop, and we're inhaling and inflating into this side body. And then on the exhale, as we draw our navel into the spine, we're reaching with our elbow like we're trying to touch the ceiling. Actually, before we do that, I want to continue to get this exhale, drawing navel in and scoop the pelvis forward. So inhale, let the hip drop, fill up that side bowl of the abdominal wall. Exhale, draw navel in as you scoop, and then we're going to add in also reach up through that elbow. Inhale, we're letting the shoulder soften, that back hip's dropping all the way down, and we're filling up that side body. Exhale, drawing navel in, scooping the pelvis, and reaching up to the ceiling. Inhale, letting it all the way back. Hip drops, fill up that side body. Want to get that expansion of the balloon. Exhale, navel, scoop, lift the elbow up. See if you can feel some length stretch associated with reaching to the ceiling through the same side body that we're filling up and expanding on the inhale. It's almost like there's going to be 2 stretches here. One stretch associated with the inhale, getting that side body to expand like a balloon. The balloon's going to stretch. And then on the exhale, as we scoop, by lifting and reaching, we're also creating length, which is also a stretch. So we should get a stretch on both the inhale phase. It's different type of stretch than the stretch that we get on the exhale phase. And then we'll switch across and see if we can get into that same movement on the other side. So left side shin box, left arm's coming across, forearms flush with the ceiling. Inhale into that side body space, left side, allowing the opposite hip to drop to the floor. Exhale, navel to spine, scoop the pelvis forward, and then we can add in our lift through the elbow. Inhale, letting the elbow soften, hip drops all the way down, and filling into that side body space. Exhale, navel, scoop, and then lift of the elbow. Notice if it's easier or more challenging on this side or the other side. This side is a little easier for me to access and get into the movement better. My side body space is not quite as tight and restricted. I can get my breath to move and my hip drops more. My left hip tends to be a little bit more compressed and restricted than my right hip. Then we'll flip back across to the other side. And now we're going to get into our folds. So with folds, I'm going to use the shin as the arrow. We're going to inhale, filling in that same side body. So I want to let that back hip drop, filling in that same. I'm on my right side shin box, so I'm filling up that right side bowl of the side of the abdominal wall. Exhale, I'm drawing navel to spine, and we can get a light scoop of that pelvis, and then we're reaching both hands evenly through that shin, and I want both hands to reach at the same amount. I don't want one hand that reaches further, because that's generally going to be a sign that we got some tightness and tension into our low back. So exhale, reach. Inhale, we're bringing it all the way back up. Letting that back hip drop down as we expand through that side body. Exhale, navel to spine, light scoop, and then reach. And once we get 5 breaths, we're then going to switch back across and do the same thing on the other side. So inhale, I got left shin forward, inhaling into that left side body. Exhale, drawing navel into spine, light scoop of the pelvis, and then even reach through both hands. Inhale, bringing it all the way back up, allowing that back hip to drop, and then filling up that side body breath. Notice how does it feel on this side? It's different than it was on the other side. Is it easier to get into your breath, allowing that back hip to drop? On your exhale, are you able to reach as far? Or do you find that one hand wants to reach a little bit further and you got a little bit more tightness either in your hip or in your low back? Noticing where the tension is really helpful, especially when you come in for your sessions. All right, so now we're going to start to work a little bit side to side, working through our pigeon. At this point, I'm going to let some of the focus of the breath go and just start getting into the folds. So I'm going to change my orientation. I like working one direction, so I'm going to give you 2 options as far as a transition. One transition is a windshield wiper transition, keeping feet in contact with the floor, hands go down, knees come up together, and they spiral. I want to go nice and slow through that transition to make sure that I can maintain good posture and that my hips feel smooth. I don't want to get clunky and discomfortable in the hips. The other transition is the thread through. Thread through allows you to stay in the same position facing the same position on your mat. Back leg is going to lift, spiral around, thread underneath the front leg, and then the front leg lifts, spirals around back into our shin box on the other side. So those are our 2 options. I'm going to go with the thread through because I like to face the same way. Each time we get to the thread through, we're exhaling and reaching with both hands. Inhaling, coming back up. And then we're going to transition across to the other side. You get to have an extra breath cycle as you transition. And then exhale as you reach. And we're going to go back and forth on this a good 5 up to 10 times. For the first 5, I want to just be in my nice simple shin box, kind of reaching forward through the shins as we exhale, so that we can get a little bit better sense of comparison of how it feels on the right side compared to the left side. I also want to notice, kind of pay attention to the quality of my transition. When I transition from left to right, does it feel as smooth as when I transition from right to left? Or is there a difference? Once you've done 3 to 5 reps back of each side, then we can start to open up our shin box and get more into what we'd look at as a pigeon. We're just going to let that back leg slide back a little bit more. Nice easy reach as we exhale. And then we're bringing it back up and doing the same thing on the other side. Nice open up shin box. Exhale as we reach. By changing the position of our shin box, we're placing our hips in a little bit different load patterns. So you might notice some differences in the right side compared to the left side as far as what feels tight and tense in the hips, especially in that back hip. And with each one, we're going to see if we can open it up a little bit more without forcing it. Make sure that we are not pushing it. The end range is the least important part of what we're doing here. I'm really looking at the quality of the movement and seeing how far can we go comfortably, non-painfully. All right, so now we're going to shift into our quadruped position, spreading hands nice and wide, grounding palms, extending the elbows fully without locking. I also want to have the toes kind of nicely tucked in the back. We're going to get into our wrist mobility. Inhale. We're going to inhale into that balloon breath. So I still want to feel that expansion down into the abdominal wall in all directions. On our exhale, we're allowing our weight to shift forward, and I want to load into the wrists. Just noticing, how does this feel on the right wrist compared to the left wrist? Inhale, we're allowing our weight to rock back. Exhale, going right back into the wrists. With each one, we're seeing if we can load a little bit more. Can we load a little further without going to pain or discomfort? And we'll stick with just like a simple 5 reps for each of our wrists. After 5, we're going to turn fingers out to the side, and we're going to get into our side-to-side glide. Nice exhale as we push away from our palm. Inhale as we move back to center. Exhale as we pull into our palm. So both palms are active. My palm I'm moving away from is pushing. The one I'm coming to is pulling. And I want to feel that nice active push and pull all the way up into the shoulder blades as well. Can you feel the shoulder blades kind of actively moving along the rib cage relative to how active you are with pushing through the palms of your hands? And again, paying attention to how does it feel on the right side compared to the left side. So one side tighter, tenser, more restricted. Is it painful? Turning fingers back towards the knees. Closer the hands are, the less intense this is. The further out we come, the more intense. I don't want it to be super intense. Keeping the palms as grounded and loaded as you can. We're going to inhale forward and exhale as we let our hips sink back to heels, loading into the forearm space. Again, continuing to breathe into that balloon and exhale, drawing navel into the spine lightly. Next, we're going to flip the palms upside down to the back side, and we're going to allow those elbows to bend. I want to pay attention especially to the elbow space. We're going to very lightly press into the floor and extend the elbows as much as we can to see if there is a stretch associated with that extending of the elbows. If you feel a stretch, then we want to play in that juicy nature of the stretch. Allow the elbows to bend on the inhale. Exhale, press and extend lightly into that stretch. With each one, see if you can get a little bit more range without forcing the stretch, without taking it to pain or discomfort. Just by mobilizing it, does it give you a little bit more extension? If you're able to extend the elbows fully without locking them and without any stretch, then on our exhale, we can allow our hips to rock back to heels. Inhale forward, exhale, rocking back. Again, I want this to be a light load on the wrist, not a heavy load. I don't want this to be uncomfortable or painful. And then we'll go ahead and roll the wrists out just a little bit. We're going to come right back into our quadruped because we're going to get some spinal waves. So actually, we're going to do foot mobility first. So back to hands. Now I want to tuck the toes, and I want to especially feel the big toe tucked underneath. I want to get as much extension on the big toe as we possibly can. Try to keep your heels pointed straight up to the ceiling. I don't want the heels to roll out into the side. That takes us off our big toe joint. The more the heels are turned up to the ceiling or even a little bit towards each other, the more load you're going to get directly onto that big toe joint. From here, as we inhale, we're forward. Exhale, we're allowing our hips to sink back to our heels. Inhale, inflating that balloon. Exhale, drawing the navel to the spine. However, as we exhale, I don't want to let the butt scoop. I don't want the tailbone to scoop on this one. Even though we are drawing our navel in, which kind of makes that pelvis scoop, I want to actively tilt the tailbone up towards the ceiling as we're sinking back and loading into the big toe joint. We're still drawing the navel into spine. We're just resisting the movement of the tailbone. Inhale forward. Exhale. See if you can load a little bit more into that big toe joint. Can you start to feel the big toe joint load? Can you start to feel some stretch into the arch of the foot? How does it feel on the right big toe compared to the left big toe? There's going to be a difference between the two. It may take a few weeks of working on this from a mobility standpoint in order to develop the neurology to be able to notice the difference between the right and left big toe. So this one's a big one to just practice for a while so that you can start to feel the difference between the two. Next, we're going to let the heels turn out as far away from as possible and getting all the other toes tucked underneath to the best we can, including the pinky toe. If you have trouble getting that pinky toe tucked underneath, then that's going to be an indication that there's a loss of foot mobility. So we want to work on that and try to get that foot mobility back. On the inhale, we're forward. Exhale, letting the hips sink back to the heels. And again, I want to resist that tailbone. Keep that tailbone turned up towards the ceiling lightly. Inhale, filling up that crocodile breath. Exhale, navel into spine. Notice how this one feels on the right compared to the left as well. Do you feel a bigger stretch through the lateral arch of your foot on one side compared to the other side? And then the last for the foot we're going to do is we're going to load lightly into tension, not all the way down. And from here, we're going to do windshield wipers with the heels. Let the heels roll all the way into the big toe joint. and then all the way back out to the pinky toe joint, and moving back and forth. And I want to feel, how does that feel as we move from one toe, big toe, out to the pinky toe, and then pinky toe back to the big toe? How does that feel on the right side compared to the left side? Are there points that feel a little clunky? Maybe it feels disconnected. It's difficult to get the same position, or it might be a little sore and uncomfortable. I definitely want to pay attention to make sure that we're not moving into pain. All right, so now we're going to get into our reverse sit or inverted position. Hands are coming down next to the hips, grounding through the palms and spiraling the elbows out and away. I want to feel those shoulder blades drawing down the back and that lift that takes place through the sternum. So as we spiral elbows out, shoulders pack, sternum lifts. And we're going to just go straight into our neck mobility. So spiraling out, nice open chest. From here, if you feel, if it's easier to cross your legs to maintain that position, you can cross your legs. But I want to be nice and open, spiraled, and actively pushing down through the palms of the hand. I want the shoulder blades actively reaching down to the floor so that that sternum is lifting up to the ceiling actively. And from here, we're going to start with checking our blind spots. Slowly looking over right shoulder. I want to see how far can we turn our chin to get over the edge of the crest of our shoulder. I want to make sure that our head is not tilting through our forehead. So I want to really reach the chin as much over as possible. I also want to see how far do my eyes go back. How far can I get my gaze to actively look back? So I want to look into the corner creases of my eyes and even see if there's a little bit of stretch of the eye muscles with the neck muscles. And we're going to do this going side to side. So exhale as you turn and look to the left. Nice squeeze. Inhale as you come to center. Exhale as you turn to the right and squeeze. Again, reaching from the chin and looking through the corners of the eyes as far as you can. Notice, how does this feel on the right side compared to the left side? Are you able to get your chin to go further? Are you able to get your gaze to go further? Is there a bigger stretch on one side? Does one side feel less mobile than the other? I have a lot more mobility to the right. It feels smoother and easier. My left feels a little tighter and restricted, which might be related to some tooth issues I'm having, because it's a little tighter than usual. Next, we're going to get into our tilts and lifts. So light tilt of the head, like we're dropping our one ear down, and we're going to actively lift like we're trying to touch that opposite ear up to the ceiling. We want to make sure our shoulder blades are actively pressing down, elbows are spiraling out. I don't want the shoulder to lift up as we're lifting our ear. I want that shoulder reaching down as we're lifting. That will create traction stretch in the side of the neck. We're inhaling at center, exhale as we tilt and lift. This is a really valuable assessment. It's great mobility, a great stretch, and a powerful assessment tool. If one side of this feels tighter and more restricted, you're not able to lift as far, that's going to be a big deal. This is one that I definitely want to pay attention to and take notice of. And if there is an imbalance, then I kind of want to feed a little bit more of this movement into my practice throughout the day. Even 5 reps at a time can be really, really helpful. Next, we're going to get into glide, keeping the cheekbones on the same plane. We're seeing how far can we glide our head side to side without tilting and without rotating. So I don't want my head, I want to keep my cheekbones on the exact same plane. My forehead tilts, I'm going to be off balance. And I don't want to turn, so I don't want to rotate the head. Again, palms are down, active shoulders down. We are exhaling as we glide across. Inhale back to center. Exhale as we glide across to the other side. Keep the movement small to start with, especially if this is new. It's very helpful to do this in front of a camera or a mirror so that you can see the quality of the movement, whether you are doing it correctly. Because it's really easy to get little tilts and turns and not notice it unless you're in front of the mirror where it becomes a little bit more obvious. So it's a little easier to build your control doing this from in front of a mirror at first. And it may be like you may only be able to move 1/4 of an inch on each side, or you might be able to move an inch or more on one side and only 1/4 of an inch on the other side. Though that's going to be incredibly relevant. If you can go easy and full on one side and not as much on the other, that's going to be a big deal. That's going to be something that we definitely want to pay attention to. And again, that would make this a movement that I want to start incorporating into my daily practice more frequently. All right. So now we're going to get into V-sit. Nice wide V. Actively reaching the knees down into the floor, actively pulling the top of the foot back like you're trying to fold the foot back. Hands can go behind the hips. Nice grounded palms, spiraled out elbows, open chest. Shoulder blades reaching down into the floor so we have a nice tall spine. I want to focus largely on the kneecaps. We're turning the kneecaps as far out as you can go. You're seeing how close can you get the kneecaps to turn to the floor on the outside, and then how far can you turn your kneecaps into the inside. How close do they get to the floor? And I want to move from the kneecaps and not from the foot, because I can get a lot more movement from my foot, but I'm not actually moving all the way up through the knee. So I'm not paying attention to the foot. I want that foot pulled back towards the knee, and I want to spiral the knee as far in. Inhale as we come to center. Exhale as we spiral as far out. Again, actively reaching the knees to the floor, actively pulling the top of the foot to the shin at the same time. Can you feel this mobility all the way up into the hip socket? The more you're focusing on the knee, the more we're getting that spiral action all the way up into the deep hip, and that's where we want to get that work. I'm trying to get that work all the way up into the deep hip rotators. Inhale, we're filling up that crocodile breath. Exhale, navel to spine. And our inhale is happening as our feet are straight up. Our exhale is happening in both directions. Rolling out and away. Inhale to center. Exhale, rolling in towards the floor. All right, so now we're going to change into coming back to hands and knees, but we're going to get into our frog position. So on hands, knees are going to come out wide. We're going to let the knees go as wide as we can. Feet are staying close together. They can slightly touch, or they can be right, lightly touch is a good place. But knees out as far as comfortable as you comfortably can. We're going to inhale as we're forward, and on the exhale, we're allowing our hips to shift back all the way into our heels. Inhale, we're rocking all the way back forward. And with each exhale, we're seeing if our hips can sink a little deeper. I want to really feel into the hips, deep hips, just the same spot we just worked with our V-sit. I want to see how that feels as we glide forward and glide back. Our inhale coming forward is still filling up that crocodile breath or balloon breath. Our exhale, we're drawing navel into spine. But just like on our foot mobility, I kind of want to turn that tailbone up to the ceiling lightly. I don't want to let it scoop too much. Keep that tension by reaching the tail up as you sink back. Right now I have my toes untucked. So I want to do a little bit of this untucked, and then we're going to tuck the big toes so that they're loaded underneath a little bit, and we're doing the exact same thing. This will now load the big toe joint a little bit, and it changes a little bit of the load into the hips. Notice if you get any sensitivity in the knee, especially that medial crease of the knee where the knee is in contact with the floor. That can be useful information as well. I have a little sensitivity in my right knee right now. My right big toe is a lot stiffer. So when the toe is not moving as well, it tends to put more compression into that medial compartment of the knee. So this is a good assessment point for potentially some toe mobility work in order to get some relief for knee pain. We're going to go ahead and untuck the toes. If this is an easy position and you can get pretty good range, we can now drop down to our elbows, and we're going to do the exact same thing. Exhale, shifting our hips back to our heels. Inhale, bringing our weight forward. Inhale, we're forward, we're inhaling, expanding that balloon. Exhale, drawing the navel into the spine. And again, resisting that scoop of the pelvis. So just lightly keeping that tailbone lifted towards the ceiling. And this should be like a nice, juicy stretch. I don't want this to be incredibly intense, and I definitely don't want it to be painful. If it feels any of those things, then I want you to come out of it, get onto your hands, and make it easier. Good mobility does not come by forcing it. It comes from ease of practice. We'll go ahead and come back to our hands, and we're going to come a little bit forward so that we're not in tension on the hips. And now we're going to do some spiral action through the hips by lightly lifting that ankle up towards the ceiling, one ankle at a time. Seeing how high can you lift that ankle, bringing it all the way back down, and then the same thing on the other side. So by lifting that ankle, I'm spiraling through that hip all the way up into the hip socket. And I want to see how far can I spiral on the left side compared to the right side. My right side has a lot more range available to it than my left side does. My left side is a little bit tighter and more restricted. I cannot go quite as high. As you're doing this, you can allow a little bit of shift back in order to create more tension and continue to work that lift. With more tension, you're probably not going to lift quite as high. So I don't want to force it. Definitely don't want this to be stressful on the body or painful. If it's at all stressful or painful, then I want you to back off. All right, so last thing, I want to do a little bit of deep squat breath work. I forgot to mention having wedges at the beginning or a 2x4. So we got a couple of options here. If you don't have these, it's not the end of the world. We can do deep squat work without them, but one option is a 4-foot 2x4, and the other option are 2 yoga wedges. And we're simply going to place them hip width apart, letting the heels go on the wedges so that we get a little bit of heel lift, while being able to maintain weight and load into the heels to work on a little bit of a deep squat. This is simply a little bit of a cheat to allow us to get into a deep squat comfortably and a little bit more safely. If you're using a 2x4, we're placing the heels on the 2x4. Balls of the feet go on the floor. And I want to make sure that we're maintaining even weight through the heels and the balls of the feet. If you don't have a wedges or 2x4, we can do this on the floor, but it may impact how deep you're able to get into the deep squat, which is okay. However deep you're able to go is where you're at. So I'm going to use the wedges because they're right in front of me. From here, I want to keep even load in the heels. I don't want the heels to lift up off the wedge. I want to feel the weight of the heels into the floor. I want to feel gravity pressing down into our heels as well as into the balls of both feet, balls of the big toe and the pinky toe, all the way through. We're going to see how low can we go into a deep squat comfortably without pain and without stress. I want to be able to maintain the position for 30 up to 60 seconds without it becoming stressful. So however low it is, it does not need to look the same as it looks for me. Your body is your body. I want you to find what is comfortable for you and start there. By practicing this daily, you will see improvements daily. So we're going to take an inhale breath as we slowly feel into our deep squat. Having the wedges makes a huge difference for me. I can get nice and tall in my squat. From here, I want to come right back into our crocodile breath, feeling that breath expanding out and away through the abdominal wall. Exhale, drawing that navel up and in. Nice expansion out and away. Exhale, draw that breath up and in. Once you get a few breaths and you're able to feel that expansion on the inhale and that drawing in on the exhale, we can start to let that breath fill up all the way down into the pelvic bowl. On the exhale, as we draw our navel in, we can squeeze. We can do a light Kegel. I don't want to do a hard Kegel, just light squeeze. And then on our inhale, let that breath move down into that Kegel and feel it open it up and expand. I want to feel that breath expand down into the bowl. On the inhale, exhale, we're squeezing and getting that nice little tension in the pelvic floor. The more important part of this breath is the inhale and feeling it expand as much as we comfortably can. The exhale, we're simply lightly activating that pelvic floor and getting a little bit of a clench. Again, and this is like we're trying to hold a number 1 or a number 2, right? This is a little bit of a squeeze of that pelvic floor, and then we're inhaling lightly to feel that pelvic floor expand. And then we're going to come out of our deep squat. I don't want to stay in that deep squat for so long that it starts to be uncomfortable. So if you can only do it for 15 seconds at a time, that's fine. It's okay to come out, take breaks. And we're going to come back to the floor with our chair, and we're going to finish with our crocodile and turtle breaths. So placing the feet on top of the chair. Feet are touching, ball of the foot and heel touch. Knees are shoulder width apart. We're going to start with our crocodile breath, making our big C shapes with our hands. Nice inhale. Expanding out and away. Exhale, drawing the navel all the way into the spine. As you inhale, see if you can feel that back musculature expanding down into the floor and that back spreading out across the floor. Just like if you were to inflate a balloon, that you had some weight on it so that it could not expand off the floor. It had to expand into the floor, right? I want that same sense and feel for our low back or low back wall of the abdominals. After 5 breaths, we're going to place our hands on our knees, press and extend the elbows out, and then actively pull the knees in. I want nice pressure through that abdominal wall from that active push and active pull. We're doing the exact same crocodile breath, expanding out and away. On the exhale, drawing navel all the way into the spine. And on the inhale, next inhale, we're letting that breath move all the way down into the pelvic bowl, feeling that open. On the exhale, light Kegel as we squeeze. And then next inhale, immediately breathing into that squeeze to feel that squeeze expand into length. See if you can feel your low back stay soft and spread wide on the floor. I don't want that low back to start lifting off the floor in either breath's direction, inhale or exhale. As we inhale, that expansion of the balloon presses everything out and away. As we exhale, we're drawing our navel into the spine, which is keeping that spine tight to the floor. After 5 to 6 breaths, we can relax the arms, relax the legs, and we'll just take a few more nice big breaths in. We can let that breath kind of move up into the ribs on the inhale, up into the shoulders, up into the neck, kind of breathing into tension of the rest of the body. And on the exhale, start to allow that tension to rinse off onto the floor. This is a good time to just kind of have some nice scans of the body, noticing where does that breath move well, where does it feel tense and tight and restricted. If you have an area that feels kind of dense, maybe it's a spot in the ribs or up in the shoulders or the neck, just bring the energy of that breath into that space lightly. Breathe into the tension, and on the exhale, see if you can allow some of that tension to release onto the floor. And when you're ready, we'll go ahead and open our eyes, and we're going to slowly get up and check in with the body.